COVID vaccinations are ongoing. We continue to vaccinate the community as much as we can. As most people are aware, the points of dispensing, the participation has been waning some. So now we're kind of changing our strategies. We're moving our dispensing over to the local county health departments, and we're administering shots on Mondays, Tuesdays, and Thursdays. In the morning, they're based on a walk-in basis, or you can still make an appointment in the afternoon or the morning, but we are allowing walk-ins to come in through the morning. And of course, we still can make those appointments on vaccinate.oklahoma.gov. The address for the health department is on Tamarack Road, but the big focus is now, since most people that have been interested in obtaining a vaccine have already received it. So now we're talking about appointments of convenience. We want to go to you. For example, homebound individuals. We want to know where they are. If you or someone you know or a loved one can't ambulate to the health department to obtain the vaccine, please let us know and call us at the health department. And that number is 580-482-7308. By calling us at that number, we will go out and give that patient a shot in their home and then stay with them and monitor them for 15 minutes or 30 minutes, whatever the case may be. So that is one way that we're really trying to reach out. Another way is by going to places of convenience. For example, this weekend there's open streets in Altus, and it's from 2 to 4 that we'll be there in the corner of Hudson and Commerce, somewhere around there. And we'll be administering free COVID vaccines. So we want to go where you are, where you work, where you play. We've made a concerted effort to visit businesses in Altus. And if there's a business out there that would like for us to come and vaccinate their staff, or even their patrons, if that's what they want, we would be more than pleased to go out there and accommodate you. That's one of our efforts of convenience. So we go to where you work and play. For 65 and older is like 64% have received both vaccines, both the primary and the booster. That is extraordinary, but we're still trying to get that number improved. There's a little discrepancy between first and second shot for our over 65 population, and we're trying to bridge that gap, get people back in, go out and reach them and make sure they're fully vaccinated. Even one dose of Pfizer has proved extraordinarily effective against COVID, but we still want those 2 shots to come through. I wish that we could address the population of young adults, those over 60. Across the state, we've only addressed less than 1% of the population between 16 and 17-year-olds getting the vaccine. And of course, Pfizer is the only option for them. So that would be incredibly helpful if we could convince the parents of those young people to allow their child to be vaccinated. Sometimes we talk about vaccine hesitancy, but now we're kind of talking about vaccine complacency. So it's people who think, oh, I'm not going to ever get it. I'm healthy, I'm young. And those individuals we're trying to address, we're trying to convince them, we're trying to meet them where they are. Appointments of convenience. If it's at a baseball tournament, maybe we need to go there and vaccinate fans at a tournament. It's not a feeling of invincibility more than it's a feeling of, I'm okay. I had a whole year, I didn't get it, I didn't even feel any symptoms, and I think it's more complacency and not invincibility. Individuals that are concerned about the vaccine, we do ask that they complete their due diligence. It's a personal decision on whether or not you want to be vaccinated, but it's also a decision that impacts the community, your family, your livelihood, and so we ask that you make those decisions on your own with the benefit of science. We can provide whatever materials you might want to know. We answer questions all the time. The State Health Department has at least weekly Q&A sessions with the Commissioner and the Deputy Commissioner on updates about the vaccine. So we would be more than happy to answer any questions that someone would have. At this point, we are welcoming walk-ins And that could have been actually a drawback at some point, is that the portal initially was much less user friendly, but there have been a lot of improvements to the portal since we first started. And I believe that if someone were to try and get in there now, I think they'd find it immensely easier. However, we are taking walk-ins, whatever it's going to take to get you in to get a vaccine from the health department, or to go out into the community and give it to you there. That's our objective. That's our mission.